Hi everyone. Today I'm very excited for our topic, and we're talking all about treatment dosages and how to really manage the treatment dosage and what's the best treatment dosage, how to understand when you should stop treating and when you should do more treatment. So first off, I would like to apologize for starting this live just a few minutes late. Unfortunately, my previous client was just running a few minutes late, and so that's why I'm late here. But of course, clients always do come first in our priority list. So let's get into it. If this is your first time joining Shink University, I would highly suggest hitting that little like button, the thumbs up, and adding Shink University to your playlist so that way you can catch all the new videos coming out on this channel all about Japanese acupuncture and moxibustion. It's completely free to you and you can always change your mind. So let's get straight into it. And if you have any questions about treatment dosage, issues that you've had in the past, anything like that, go ahead and make sure to put them in the comments. And then we can have a little bit of a conversation about this together as a community. So the reason why I wanted to bring this up is because I very recently treated my mom after she had a really, really bad fall. So if you follow any of my social media, you probably saw a picture of me treating my mom's face. It was very, very badly bruised. She actually got super dizzy and fell off of her front porch, which is about 2 steps above her driveway, into her driveway. She actually fractured her orbital bone. She broke her nose. She fractured a bone in her wrist, and she really beat up her knee. So she had a really, really bad fall, and they still really don't understand why she was falling, more than likely medications. But I had to step in not only to advocate for my mom, but then to treat her because unfortunately, post fall, she did have to have surgery in order to put a plate here on her orbital bone to keep the shape of her orbital bone in her face. But afterwards, of course, she had a ton of bruising. She had like 10 stitches up here, and she had a really, really hard time and still has a little hard time opening up her eye. So initially, when I very first started treating her, sorry, I can't do a screen share to show you the pictures of this, but her eye, if just to give you a visual, her eye was like, her other eye was open normally. I have to like close my eye to do it. Her other eye was like that. So she really couldn't even open her eye. There was so much swelling and so much inflammation around her eye, obviously from smacking straight into pavement. And so I did a lot. Initially, my first go-to for treating bruising is, of course, Chinetsu, and I didn't have a ton in my kit that day, so I had to use a lot of stick-on moxa. And I did a lot of the stick-on moxa, and it was really helping with the bruising, but it didn't help with opening up her eye. And I wanted to be very careful about treating her because, of course, she was just post-surgery. She had just gotten out of the hospital and all of these things. So I was in the forefront of my mind is always, I don't want to over-treat the client. And so what I get into how I decided to treat and what I decided to do and then what happened afterwards, let's talk about what over-treatment actually looks like, and what the proper amount of treatment actually looks like, and just really define those two subjects. So over-treatment, essentially, if you treat your client and they come in, let's say they're coming in for knee pain, and you treat the client, and after they go home, they have an increase in knee pain, or let's say they get super sick. Um, and then after the sickness fades or the knee pain, that extreme spike in knee pain fades, they have the same amount of pain that they had previously. That is over-treatment. That is the definition of over-treatment. Now, if you have the same situation, let's say you treated for the knee pain and they got flu, and then after the flu went away, their knee pain was actually less than the beginning of that treatment. That is what's called mengen, or a healing phenomenon. That is a correct amount of treatment. So over-treatment is really oftentimes, I find, confused with just a healing phenomenon, which it's definitely not. You need to be very careful about your dosage. What we do with acupuncture and moxibustion can over-treat the client. So I really think it's an important thing to just get that foundation of understanding solid between all of us in the community. So getting back to my mom. So I had done all of this mox. I had done several stick-on rounds. I probably used like 20 on around her face. It did heavily take away her bruising, but she still couldn't open up her eye. And so I had a really hard decision to make. And that was, I knew that she needed to have bloodletting. The reason why I knew she needed to have bloodletting is obviously she had blood stagnation, not only from the surgery, but also from smacking her face into pavement, from getting 10 stitches. All of those things are going to create blood stagnation. A bruise is literally blood stagnation. Chinette's Q is just usually a little bit easier to use to help that. By the way, if you don't know what Chinette's Q is, I have a video on how to make it within my YouTube channel. So you can just type that in. Starts with CHI, and then you can go from there. So anyway, so I'd done all of this moxa on my mom's eye, and I was like, okay, well, I have to now make a decision. Am I going to do bloodletting and it's going to be so much for her that she's going to get exhausted and can't sleep for 2 days? Or is the bloodletting going to actually help her eye? And so there's a time when you have to, as the practitioner, make that leap. And I know that all of you probably have, where you're like, I don't know if this is the right decision, but I need to make that leap because I feel like I have to do it. And then afterwards, you have to actually see what happens. And this is a really important thing. So we'll talk about that in a second. So anyway, one of the coolest things that has ever happened to me in treatment, I think ever, is I bloodlet my mom in three different places, excuse me. So I did one right here along the large stomach channel, excuse me, maybe closer to the large intestine. And then I did one point here around the bladder meridian, somewhere around here. I'm not like, I don't do point specific treatments, so that's why I'm not naming a specific point. And then I also did one here. I think it's called yin tong in TCM. Now, these 2 points really drastically helped my mom to be able to lift her eyelid and open her eyelid, but none of them really did the trick. The super interesting thing that happened, though, is when I did right here at yin tong, I did a small little bloodletting right here, and my mom's eye literally started to bleed blood. I am not joking you. It started to tear blood out of the eye. And obviously her eyeball was not bleeding, obviously, thankfully. What had happened was her eye, the tissue around her eye had started to release the broken capillaries and the inflammation that had been created around her eye. And even my mom, I had to show my mom, I have a picture of it, a substantial amount of blood that came tearing out of her eye. And even she was like, my eye's itchy, I have to wipe it. I was like, Mom, you're actually bleeding out of your eye. She didn't believe it until I showed it to her. And she was like, yeah, I've been getting like pink tinged tears, but nothing like this. It was a bright, almost dark red color coming out of her eye. So what happened with this one point? What was that? That by releasing the blood here, what actually happened was a Mengen response, a healing phenomenon response, where her body actually started to push out the physical toxins that were in the body through her eye. And like I could physically see that blood stasis coming out of the eye. If you're interested, I'm going to put some social media pics of it probably tomorrow on my social media account. So we actually had that healing phenomenon response. And on top of that, after that, my mom was able to substantially open up her eye, more substantial than she had throughout any of the moxa treatment. It was one of the most profound results I think I've ever gotten so quickly with a client, and I've gotten many. But to have someone's eye bleed, I think that's pretty cool. So getting back to this idea of like treating too much and treating the right amount, and when do you know which is what, right? So obviously with my mom's case, I knew that bloodletting here at Yin Tong was the right amount because not only did it help her situation, but it continued to help her situation. She didn't get worse after the treatment. And so that's one of the things I find is the least done in TCM practitioners is they fail to follow up with their patients. So an example of this is I had a associate acquaintance who was a brand new acupuncturist, just graduated acupuncture school, and we met one day for coffee, and they said, "Oh, I'm so excited! I've just treated my very first induction client. I'm so excited!" And she went into labor that day, and I said, "That's amazing! Congratulations! How was the labor?" And she looked at me And she said, well, what do you mean? She went into labor. And I said, no, how was the labor? Was she able to sustain her labor? Was she able to have a baby on her own? Or did she have to have intervention? Did she have to have a C-section? These things are really important questions that you need to follow up with your client about. And those questions, the reason why you need to follow up is because those questions are going to tell you if the treatment you did was too much or if it was just the right amount and actually helped the client. So for my mom example, I did the bloodletting at Yin Tong. She started literally bleeding out of her eye. Her eye opened more. She had more vision. She felt more, she was happier. She had more energy. Like you could visibly see that she was more bubbly than she was when I came in. She was quite tired, you know? So all of these things tell me, and then I was able to, of course, she's my mom, so I'm talking to her a lot. I was able to follow up with her throughout the week and make sure that that treatment stuck. Now, if she had had that result, but then had a sharp decline and actually not able to open her upper eye half as much, that tells me that it wasn't enough treatment, not that it was over treatment. So again, over treatment, almost always you're going to have a spike in something, spike in the pain, spike in sickness, a huge bout of dizziness that after the dizziness fades, the symptoms are the same. However, let's say with my mom's treatment, her eye was really, really good. And then 3 or 4 days later, her eye started to decline. That means that she needed another treatment or possibly more treatment initially, more than likely another treatment. So it's really important to understand the difference between these two things because it can make or break your efficacy of each and every treatment. And if you're able to follow up with your clients, which I hope you are, that you're getting their contact information, then you should be able to get this information from them. And not only does it show, when you follow up your clients, obviously it helps them to understand that you're in contact with them and you care about them, but it also gives you such valuable information, right? Was with this client, with this type of client and this type of presentation, when I do this technique in this way, I get this result. And that result is either too much or too little, right? Or just the right amount. And obviously we want that just right amount. And you're able to then store that in your brain, and that's what becomes your experience, right? So on top of that, let's talk a little bit about Mengen before we wrap up the live for today, because it's about 12 minutes at this point. So let's talk about Mengen. So Mengen literally means, it has two of the characters that really mean dizziness in the word Mengen. One of the symptoms of Mengen, again, this healing phenomenon, is that you get usually quite dizzy post-treatment. Now, this is completely different from what people in the US here term acu-high. So acu-high is when you finish the treatment and all the patient's energy or their ki is all flowing up to their head and they literally feel high. That is simply that you have not grounded the patient's energy in their feet. Now, if they feel dizzy at the end of treatment, and then after the dizziness fades, right, their symptoms are better, or they feel dizzy, they have a spike in some type of symptom, and then they get a lot better, that is Mengen. So it's really important to understand those finite approaches. Now, when it comes to the techniques applied to each individual treatment, how to approach individual situations, unfortunately, that's something that you need to have, in my opinion, a really good mentor to help you with. So if you know me and you've been on my channel a lot, you know that I really am a proponent of getting a mentorship. Now, whether that's through Shinkyu University or someone else, that's totally your preference. But having someone like myself who you can come to and say, look, this happened with this client in this way. I can then start asking you questions like, okay, how is your technique looking? What kind of technique should you be using? Let's talk about the things that you might have missed with that client. Let's talk about different approaches that you haven't thought about. So you're able to have that sounding board, and then you're also able to, have this sounding board to say, look, I did this treatment. We had these kinds of results. Then a mentor like myself is able to tell you, you treated too much. That was way too much. Or you needed to do a little bit more, perhaps, or you needed to consider the avenue of moxa. Maybe you didn't do the moxa enough, right? Having that sounding board is imperative to everyone's treatment. I have my teacher Yasuda Sensei, when I have really difficult cases, I almost always text him back in Japan and go, I have no idea what I'm doing. And he always texts me back going, yes, you do, figure it out. So he's not like, he's very much a Japanese mentor in that he doesn't explain things and he wants you to really work through your problems. He's there for you, but it's not a ton of information. I feel that us in the West, we tend to do a little bit better with a little bit more personalized coaching. And so that's the kind of coaching that I give my students. So, with saying that, if you have any type of suggestions about understanding how to control treatment and control the efficacy of each treatment, to not overtreat, situations where you weren't sure if it was overtreatment or this Mengen healing response phenomenon, I'd love for you to put those in the comments so that way we as a community can chat about them and kind of learn from each other about different situations where this topic can really apply. It's a very, very important one to talk about as a community, and it's an important one to talk about with your mentor. If you have a mentor, I'd love for you to have that conversation today, tomorrow, the next day, and forever. And if you don't have a mentor, I would love for you to reach out to Shink University and see if I can help fill that gap for you. I will be putting a link in the description box below. I don't believe there's one in there right now, but I'll put one in there in a minute. So that way you can sign up and see if it's a good fit for you. Yeah, and then we'll continue to have more conversations about this going forward. I did promise last week that we were going to talk about tainetsu. So I'm sorry that I skipped topics just a little bit, but this really interesting case came up with my mom, and I just felt it was too important to not talk about. So we'll be skipping back to tainetsu next week. So if you're unsure what tainetsu is, I really encourage you to watch my previous live from last week where I talked about taikan or daikan, which is big cold. And it's talking about a very stereotypical presentation of cold in the body and how you can approach that, according to Ashiwara Kengyo Sensei. And it's written from his book, Shindo Happy Kogi. So next week, we'll be talking about his other very typical protocol, which is called tainetsu or big heat, which is the exact opposite. And so he gives some very protocol approaches to both techniques. So I highly suggest you joining that. It will be around 5 p.m. next Wednesday, Mountain Standard Time. So do tune in for that. And I'm very excited to talk to you about it then. All right. If you have any questions, again, put them in the comments below. I'd love to hear your experiences. Don't forget to like, subscribe, hit the little bell to be notified of future videos, and of course, to keep practicing. All right. I'll see you all soon in the next video.